Hello everyone. Hello my dear students. Today I want to explain to you about the oral health promotion and let's discuss this chapter. After studying this chapter and completing the study questions, you will be able to define oral health promotion, identify the features that cause water fluoridation to be considered one of the 10 top health promotion programs of the 20th century, plan, implement, and evaluate an oral health program using the components of an effective oral health program, and address appropriate level of influence. And now, today our lecture's information is divided into three separate sections. Separate sections. It's a health promotion, oral health promotion, and model programs. Health promotion, the process of enabling people and groups of people to increase control over and to improve their health through change in policy and law, is explored. And the focus of this section is on community oral health promotion with an introduction to individual, general, and oral health promotion and professional and patient self-responsibility. Individual health promotion focuses on the health of one individual at a time. One individual at a time. Community health promotion is promoting health in society as a whole through policy change and program planning and implementation. So, you will learn to identify appropriate audiences and approaches for oral health promotion programs by studying risk factors for oral disease, health behaviors, determinants, and disparities in oral health. Also included are descriptions and examples of effective oral health promotion programs, including community water fluoridation and school-based fit and fissure sealant programs to assist professionals in planning, implementing, and evaluating oral health promotion activities. And you will acquire the skills needed to participate in a fluoride intervention and to evaluate oral health promotion endeavors for populations at risk. It is the desire that the student will become passionate about oral health promotion through this unit, and this unit will inspire professionals to continually be involved in interventions and educational programs for their communities. Also, community projects are difficult and they are by far some of the most rewarding activities in which oral health professionals can participate. And there are numerous interventions such as community water fluoridation that impact the entire community's general and oral health. So, health promotion is the science and art of helping people and society change their lifestyles to attain optimal health. It places an emphasis on improving quantity and quality of life for all and enables people to improve their health. Health promotion includes the use of any preventive, educational, administrative policy, program, or law to achieve this outcome. Oral health promotion is aimed at four preventable oral diseases. Remember this, please. dental caries, disease of the supporting structures, oropharyngeal cancers, and craniofacial injuries. The poor minorities and the elderly share a disproportionate amount of preventable oral disease. Prevention is vital to health promotion, and the goal of any oral health program should be to empower people to attain equity in health and to reduce the incidence and prevalence of oral disease through education and interventions. Some examples of this multi-pronged effort in dentistry are smiles across America. Healthcare for the Underserved Initiative Pipeline and the National Speed Tobacco Education Program. Now, also individual health promotion focuses on the health of one individual at a time. Community health promotion has the much broader purpose of promoting health in societies as a whole. Traditional Western medicine focuses on the treatment of disease in an attempt to improve quantity of life. Quantity of life, quantity of life refers to the number of years an individual lives. Quality of life is how meaningful a given life is, which is partially dependent on an individual's overall health. However, healthcare is evolving from disease treatment to disease prevention and more recently to promotion of health. And the World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health. World Health Organization continues to state health promotion goes beyond health care. It puts health on the agenda of policymakers in all sectors and at all levels, directing them to be aware of the health consequences of their decisions and to accept their responsibilities for health. Health promotion policy combines diverse but complementary approaches, including legislation, fiscal measures, taxation, and organizational change. It's a coordinated effort toward creating supportive environments and strengthening community action. Health promotion works through concentrated and effective community actions in setting priorities and making decisions. Incorporates the four pieces of the puzzle in the dental hygiene care plan is in assessing, planning, implementing, and evaluating strategies to achieve better health. In community development and empowerment draws on existing human and material resources in the community to facilitate self-help, social support, participation, and ownership. Because individual behaviors and thinking are not easily altered, health promotion must employ an interdisciplinary approach involving clinical care, health education, research, public policy, social science, and public health, with the overarching objective to eliminate health disparities. To achieve this objective, health promotion must address factors within society, private organizations, government agencies, and policymakers to ensure access to preventive measures, appropriate health behaviors, and a healthy environment. Organizations and governmental agencies that effect health promotions are listed, and it's clubs, churches, schools, places of employment, political parties, community action groups, federal, state, and local health agencies, and health insurance agencies. Health professionals are presented with several barriers to the promotion of health. Those involved in health promotion must recognize that health and health-related issues are subject to decisions made by governmental agencies and organizations. Further attempts at health promotion are not always successful because of the complexity of individual human motivation and other barriers such as public policy. The World Health Organization has outlined strategies of health promotion in an attempt to overcome barriers to promoting health. And World Health Organization's five core strategies of health promotion are: create supportive environments, build healthy public policy, strengthen community action, develops personal skills, and reorient health services. And the World Health Organization's focus is on removing barriers to health by working with people. There is no single indicator of oral health. However, there are health determinants and risk factors that impact health, such as genetic constitution, individual and group behavior, social and physical environment, and policy and interventions. Health depends on the complex interactions between determinants of health. Thus, health outcomes are dependent on health habits, environment, and host susceptibility. The four common preventable oral diseases have modifiable risk factors that health professionals can target when developing an oral health promotion program. Recent studies have elucidated links between general health and oral health, making the importance of oral health more significant than previously thought. For many years, oral health professionals, especially dental hygienists, have focused their care and philosophy of care on prevention. These current findings make that philosophy even more relevant. Numerous diseases or disease processes are related to oral health, and many systemic diseases have oral manifestations that may be the initial signs of the disease. The oral cavity is the portal of entry and site of disease for bacterial infections that affect general health. The function of the oral cavity can be adversely affected by medications and treatments, which may have a negative effect and treatments, which negative effect on the patient's treatment. Yeah. Oral infections increase the morbidity rate for immunocompromised and hospitalized individuals. For example, individuals with diabetes are at greater risk for periodontal disease. Further association between cardiovascular disease, stroke, and adverse pregnancy outcome has been found in animal studies and some human studies. The biological and social relationships between general and oral health challenge oral health professionals to focus their efforts on oral health promotion in order to have a positive influence on general health. However, community health professionals have discovered that education alone won't prevent disease. A more global approach is needed. Oral health promotion includes educational programs, such as tobacco prevention and cessation programs and public school oral hygiene instruction. Social programs include water fluoridation and school sealant programs. Legislative activities include creating laws and funding for programs that promote oral health and create increased access to care. Oral disease is a biological, psychological, and social phenomenon. Inasmuch as traditional Western medicine has attempted to make disease a biological problem, it is necessary to reframe health and disease as multifactorial. Effective oral health promotion strategies should focus on the structure of assuring the availability of and access to appropriate oral health services, particularly preventive technology. The oral health professional has the responsibility to promote health and to encourage individuals in society to take responsibility for their oral health. Oral health professionals must take an active role in changing the perceptions related to oral health by being involved in local and state initiatives that promote health so that oral health becomes an integrated part of general health. The perception of the public, policymakers, and other healthcare providers must be influenced so that public policy can support overall health. Healthcare providers have a social obligation to promote the health of the community through community action, community service, or political action. Prevention is an essential aspect of oral health promotion because most oral diseases are preventable. Although prevention is a critical part of health promotion, it's not by itself sufficient to improve the quality of life. The purpose of prevention should be to ensure that a disease process never starts or is curtailed, and at an early stage, early interventions are central to preventing many oral diseases. Three levels of disease prevention: it's the primary, secondary, and tertiary have been identified. Primary prevention is the intervention in disease before it occurs. Primary preventive interventions include community water fluoridation, fluoride varnish, peat and fissure sealants, and preventive education. Secondary prevention is the treatment or control of disease early in the process. Examples of secondary preventive measures are conservative amalgam restoration, remineralization of early caries, and conservative periodontal therapy. Tertiary prevention is limited the disability from a disease or rehabilitation of an individual. Examples of tertiary prevention are dentures or other prosthetic dental devices and periodontal surgery. And in the past, preventable diseases have been treated until they occur. In contrast, health promotion is intended to reduce the incidence of these diseases. One way that health promoters reduce disease incidence is through influencing social factors. Social factors including customs, values, social networks, and ethnicity, are associated with oral disease. Social factors that impact general health include exposure to conditions that contribute to illness, susceptibility of disease, habits and values, and general social changes that alert resources. So, sociologists and anthropologists have found that oral health has extensive social implications. Well-being and quality of life are related to oral health. Untreated oral disease diminishes the quality of life through lack of sleep, limited eating, and depression. Oral disease has further negative impact affecting the ability to chew and swallow foods, and therefore limiting the quality and selections of foods. Individuals with craniofacial dysfunction report that oral conditions limit communication, social interaction, and intimacy as a result of loss of self-image, limited self-esteem, and increased anxiety and depression. Conversely, oral disease and pain place a burden on society through loss of work and school days. Social factors may affect the health of an individual on the micro level, influencing the individual. The meso level, involving institutions, organizations, and social networks, or the macro level, affecting social, cultural, and political agencies. Characteristics such as age, gender, socioeconomic position, ethnicity, and race may dictate one's place in culture, community, society, or family group. Age is correlated with the occurrence of oral disease and conditions, as well as the use of dental services. The young and the elderly often have limited access to care as a result of transportation needs or other obstacles. Yet there is little evidence that aging itself causes changes in host resistance to oral diseases or disorders. Rather, accumulated exposures to systemic disease, trauma, and adverse environmental and social conditions result in a cumulative effect. An example of the micro level of influence can be seen in family income levels. Family income has a direct impact on health and oral health. A disproportionate number of minorities are at lower socioeconomic positions and have poorer oral health. Socioeconomic position has an influence on oral health. The lower socioeconomic groups have lower access to health, knowledge, and care. The cost of health care, whether real or perceived, is a barrier for those of lower socioeconomic positions. Institutions, organizations, and social networks influence and sustain individual behavioral norms and health practices. Social networks extend from the family as the primary unit to small groups and larger organizations from which health habits arise from the family. The family is the most powerful social determinant in oral health. Values, beliefs, and knowledge stem from the home and may be based in cultural traditions. Moreover, the family acts as a social network influencing norms throughout life. A mother who was taught by her mother to dip her baby's pacifier in honey to appease her fasting infant is an illustration of the role that family and culture play in the oral disease process. In that culture, it is believed that a child should be happy and the mother has an obligation to assure the child's satisfaction. Mothers from this culture learn very early how to calm a crying child. This mother is convinced that she is being a good parent and may not realize the damage she is causing her child. Health professionals may recognize that the child will likely develop early childhood caries, but the mother may not. Even if the mother realizes the ill effects of the honey, she may find it more important, based on cultural values, to appease the child. The cultural habit of the sugary food on the pacifier contributes to the disease process, whereas the baby may not develop carious lesions without the honey. And culture and society have control over oral health at the micro level. Evolving values and beliefs in large institutions and government influence their policies. These policies reflect society's beliefs, which define the missions and purposes of institutions. One example of the impact that values have on health in Medicaid dental coverage for adults. Until recently, oral health was not viewed as important, and therefore individuals and more specifically politicians didn't value oral health. Individuals who did not understand the importance of dental services formed Medicaid policy, and therefore many states don't offer dental coverage for adults. This can also be seen in the number of total Medicaid dollars allocated for all dental care. If positive health behaviors lead to staying healthy and negative health behaviors lead to disease, why it is it that those involved in health promotion don't simply tell their patients to brush and floss daily, not use tobacco, stay out of the sun, wear a seat belt in a car, and wear a helmet when they ride their bike. Adopting these positive health behaviors would result in a dramatic reduction of oral disease prevalence. Changing a behavior is difficult, even if the change is important in maintaining health. Behaviors depend on the individual's knowledge, beliefs, and values and require compliance. Although oral health professionals can educate, they can't change an individual's behavior. The patient must value and have access to preventive measures to adopt positive health behaviors. It is not enough for individuals to value prevention if they don't have access to preventive agents. Conversely, it is not enough for individuals to have access to preventive agents. An illustration of this: if a patient has dental floss, but they don't understand or believe that they are susceptible to disease or value oral health, they are not likely to use the floss on a regular basis. Likewise, if the individual understands and values oral health yet can't afford dental floss, they are still unlikely to change the behavior. Social, cognitive, and emotional factors such as stress, values, attitudes, self-esteem, helplessness, vulnerability, isolation, emotional poverty, family modeling and beliefs, and the influence of the media play a role in health behaviors. Positive health behaviors that promote general health also contribute to oral health. One of these behaviors, eating a diet high in fiber and low in fat to promote cardiovascular health and reduce certain types of cancers, has also been found to reduce the incidence of oral cancer. Eating a diet low in simple carbohydrates helps reduce the incidence of obesity and helps control dental caries. Health behaviors that improve oral health include regular toothbrushing and use of interdental cleaning devices, regular self-oral exams, and the use of oral protective mouth guards and protective gear during sports activities. These lines between the social and psychological factors become fuzzy and overlap in the discussion of health habits. Psychological habits can be influenced by an individual's environment. For example, if a person is attempting to stop smoking when their partner continues to use tobacco, the environment is such that it is much more difficult for the person to quit. And healthcare habits includes health habits can influence health either positively or negatively. Regular exercise, adequate rest, and proper nutrition have a positive effect on health and wellness. In contrast, negative health habits such as poor diet, excessive stress, and alcohol abuse contribute to disease. Negative oral health habits such as tobacco use, anorexia, bulimia, and drug abuse have a deleterious effect on oral health. On the other hand, positive habits of regular flossing and brushing and self-oral cancer screening promote oral health. Health habits are developed in early childhood because of social and cultural norms. Also, habits are formed at a young age and they can be changed with new information and individual motivation. The goal of patient motivation is to assist the person to move from a state of unawareness to a positive oral health habit. Human motivation is complex, yet it's necessary to bring about behavioral changes that promote health. There is a saying, getting between the teeth is easy. It's getting between the ears that is difficult. Individual performances are based on the degree to which they are motivated. Individual expectations, ideas, feelings, desires, hopes, attitudes, and values shape motivation. Motivation is either intrinsic from within oneself or extrinsic from an outside source. A man who sees the dental hygienist because his wife told him that his breath smells bad is motivated extrinsically. He is motivated by the hope that his breath will no longer offend his wife. Interesting motivation comes from within oneself. A woman who stops smoking because she believes it is bad for her health is an example of intrinsic motivation. This woman may have gained new knowledge or had a change in values that resulted in a behavior change, and it makes sense that intrinsic motivation is more powerful. The will to change because of belief in something is much stronger than the influence of another person. Reinforcement and punishment support behavior change. Effective motivators recognize their patients' values, expectations, feelings, and ideas and direct this patient to reinforce positive behavior. Volumes have been written on the nature of behavioral change. Psychologists have been studying behavior and how to bring about changes in behavior for years. Behavioral change is complex, and humans must be viewed in their social context. Viewing people in their social context means seeing how they live, what their daily life is about, and understanding what dynamics might support or interfere with positive health behaviors. The following example illustrates the difficulty of trying to motivate a young mother to change her behavior. For example, Maria, an 18-year-old single parent, works at night at the local mini market to support herself and her 1-year-old daughter. The absent father does not provide emotional or financial support. Maria's family disowned her when they found out she was pregnant, and she was kicked out of her parents' house. She rented a small one-bedroom downtown apartment because she's determined to provide a good life for her daughter. Maria is attending the local community college during the day and working 12-hour shifts at night. Maria is struggling to keep up with her studies while working long hours and caring for her daughter. When she gets home from work, the baby is awake and Maria is exhausted. She rocks the baby for a few minutes and puts her to bed with a bottle of milk, so she will quickly fall asleep. Maria was told that giving a baby a bottle with milk at bedtime can cause cavities, but she is just too tired to listen to her baby cry. Recognizing how complicated life is at times and trying to understand how life's complexity can interfere with doing what someone knows is best is important in any health promotion program. The professional must consider the life and lifestyle of individuals in the target population to develop an effective oral health promotion program. Psychological factors work in harmony with social factors to promote health. Health promotion activities that utilize both social and psychological motivators are often successful. Weight Watchers works with individuals who have expressed a psychological motivation to maintain a healthy weight throughout life. They utilize social motivation by having clients weigh in as a group. The peer pressure is intended to further motivate individuals as they lose weight. Access to care and utilization of services are important factors in determining the oral health of certain groups of individuals. Access to dental care varies with gender, race, ethnicity, income, and education levels. More than 108 million children and adults living in the United States do not have dental insurance, and 2.5 times the number without medical insurance. Only 42% of individuals ages 25 years and older with less than high school education visited the dentist one or more times in the previous year compared with 74% of those with at least some college education. And only 69% of the USA population reported visiting a dentist or dental clinic within the past year. The Surgeon General's report on oral health states that women use dental services at a higher rate than men. Hispanic individuals had the lowest use, and whites had the highest use. Nearly twice as many individuals living above the poverty level visit their oral health care provider as individuals below the poverty level. And further, many families with income levels above the poverty level can't afford dental services. The complexity of human nature, our society, and oral disease demands that effective oral health promotion programs have specific components. An effective program is well planned, outline the target population in its objectives and goals. Interventions. An intervention is defined as any health action, any promotive, preventive, curative, or rehabilitative activity in which the primary intent is to improve health. All planned activities that occur between baseline assessment and final evaluation are termed interventions. Interventions that have multiple activities are more likely to succeed than those that employ only a single activity. Interventions should be effective and efficient and based on sound rationale. Activities such as communication, education, community advocacy, health status evolution, incentive and disincentive, and behavior modification may be used as part of an intervention. Cultural competence, the process of effectively working within a cultural context of an individual or community from a diverse background, is an integral part of intervention and education. Education alone is not effective in preventing diseases. Personal values must be changed and interventions must be accessible. Education is another health promotion activity that has been determined effective if used with other techniques. Health promoters have defined education as any combination of learning experiences or educational interventions designed to help individuals or groups learn new health information and develop new health behaviors. Education should be specific to the target audience. For example, a tobacco education program that targets sixth grade children should include age-appropriate information activities and reading materials that are entertaining and easy to understand. The health promoter should capitalize on what many sixth-grade teachers recognize. For example, school children are captivated by interactive computer programs, fun interactive computer activities for classrooms, or um, some education that centers on oral health promotion should be developed, and specific information on health education principles is addressed later. Now let's explain the model programs. The Task Force on Community Preventive Services, an independent, non-federal group, was formed to evaluate oral health interventions. The task force made recommendations to those starting, planning, and implementing programs, and school-based programs deliver peat and fisher sealants at schools or in private practices to children unlikely to receive dental care. These programs may partner with local schools, the CDC, the National Institute of Dental and Craniofacial Research, Health Resources and Services Administration, and the Indian Health Service to target children at risk for dental caries. And the CDC reports that school-based PET and Fisher Sealant programs reduce dental caries as much as 60%. One exemplary school-based FIT and Fisher Sealant program is Healthy Smiles for Wisconsin. And this coalition of 25 agencies was organized to place sealants in 3,000 school-age children during the 2000 to 2001 academic year. Effective oral health education and interventions rely on partnerships. School-based sealant programs are one example of partnering to create effective interventions. Many philanthropic organizations are joining with universities, community health agencies, and the federal government to make the objectives of healthy people and reality. The Robert Wood Johnson Foundation is providing support to various oral health initiatives, including Pipeline and Profession and Practice, community-based dental education. And Pipeline has three areas of concentration: recruitment and retention of low-income and minority dental students, establishment of community-based practices for senior dental students in areas of high need, and development of dental curricula that support service delivery. And what about the community water fluoridation? This section is designed to provide an overview of community water fluoridation as it relates to oral health promotion. For a more comprehensive discussion on community water fluoridation, refer to one of the many preventive dentistry textbooks. The CDC stated that community water fluoridation was one of the 10 most significant public health measures of the 20th century. Community water fluoridation is the upward adjustment of natural fluoride levels in a community's water supply to prevent caries. Communities have been optimizing the level of fluoride in water systems for more than 60 years. More than 6 decades of research has proven the safety of water fluoridation. The benefits of fluoride is strengthening tooth enamel, reducing sensitivity of exposed roots, and remineralizing teeth has been so thoroughly documented that it's generally accepted as a fact within the dental community. The Center Disease Control recommends an optimal concentration of 0.7 to 1.2 ppm, depending on the average maximum daily ear temperature of the area. And the American Association strongly reaffirms its endorsement of the use of systemic and topical fluorides, including water fluoridation, as an important health promotion measure. The 2000 Dietary Reference Intakes also established recommendations for fluoride intake. Why is community water fluoridation successful? Water fluoridation is a model oral health promotion intervention. It is socially equitable. Community members who have access to public water receive the benefits of fluoridated water regardless of age or socioeconomic position. The fluoride levels are adjusted at the water treatment plant based on the naturally occurring concentration. Those is needed to receive the benefits of the fluoride without concern for using it correctly or the costly service of a health professional. Water fluoridation strengthens the host, the tooth enamel, without requiring individual behavior changes. No active participation is required. Water fluoridation as a modal intervention has been diminished by the increase in consumption of bottled water. However, it remains one of the more effective interventions, and some bottled water providers are beginning to add fluoride. And water fluoridation is cost-effective and much less expensive than restoring a single tooth. It is estimated that the range of cost to optimize the fluoride levels in community water supplies is $0.40 to $2.70 per year. This can be compared with the dietary fluoride supplement estimated cost $37 per year. A cost-benefit analysis revealed that for every dollar spent on fluoridation, and $80 are saved in treatment costs. Local, state, and federal agencies partner to support the optimization of fluoride in common community water supplies. It is easily funded through local, state, and federal budgets. The CDC recently supported communities with the initial installation of the fluoridators and monitoring devices. Community water fluoridation is not difficult to implement and monitor through standard community water systems. Community water fluoridation decreases tooth decay in adults by nearly 35%, and children who lived in fluoridated communities had 50% to 60% fewer decay, missing, and filled permanent tooth surfaces in comparison with those children living in non-fluoridated communities. The effect that fluoridation has on caries can frequently be evaluated by oral health services. One of the most significant benefits of water fluoridation is the multiple mechanism of action. It acts as a topical and a systemic agent as well as demonstrating antimicrobial activity to reduce dental caries. The primary mode of action is topical in that it promotes remineralization and inhibits demineralization by continually bathing the teeth in saliva with low concentrations of fluoride. And water fluoridation is the only community health issue that is voted on by the public. The community does not vote on immunization, water purification, on air contaminant levels. Also, it may be evident to health professionals that water fluoridation improves health for all. For voters, it is a social, economic, and psychological issue. Voters have heard propaganda from those opposed to fluoridation about the ill effects of water fluoridation, such as the unfounded claims that it lowers in IQ or causes cancer. Oral health professionals have an obligation to promote water fluoridation. For example, dental hygienists adhere to the American Dental Hygienists Association ethics code that describes beneficence. We have a primary role in promoting the well-being of individuals and the public by engaging in health promotion, disease prevention activities. Water fluoridation is clearly an effective health promotion intervention, establishing an ethical obligation to be involved. Although fluoridation can be legislated at the local or state levels, local enactment is most common. Local health officials in many communities have the authority to implement water fluoridation, but rarely execute this authority. Instead, water fluoridation is more commonly implemented through a public initiative or referendum. Although fluoridation can be legislated at the local or state levels, local enactment is most common, and local health officials in many communities have the authority to implement water fluoridation but rarely execute this authority. Instead, water fluoridation is more commonly implemented through a public initiative or referendum. Voter initiative is the process whereby an action is placed on the ballot by request of a citizen group. And voter referendum is the process whereby an action by public officials is placed on the ballot for voter support. For example, in 2001, the Arizona City Council voted to optimize the fluoride levels in community water because a group opposed to community water fluoridation wanted poor water. They gathered enough signatures for a referendum vote to overrule the city council's authority. The issue was placed on the ballot, and unfortunately, the public voted not to implement water fluoridation. Requests could have been made to place the water fluoridation on the ballot without a city council decision, which would have been an initiative. Taking a proactive approach to initiating community water fluoridation requires assessing the readiness of the community by determining public opinion, political climate, media influence, community apathy, demographics, external forces, public awareness, and perception of fluoride and health professional politics. Considerable preparation is necessary prior to a water fluoridation campaign. Those involved must be committed to an endeavor that may take years to come to fruition. One of the first steps in a community water fluoridation campaign is to identify available resources. Educating the public, engaging an experienced campaign manager, and forming a political action committee are expensive and should be considered prior to beginning a campaign. Frequently, organizations such as the CDC, American Dental Association, or the American Dental Hygienists Association set aside funds to support public health initiatives such as water fluoridation. Creativity is needed to find funds. It will not be easy or inexpensive. Community education should start before announcing an official campaign and should continue until well after water fluoridation is implemented. The education should focus on the positive scientific data speaking to the safety, cost benefit, and efficacy of fluoride. The multi-level approach should be used in education, including in office education, walking initiatives, go out and vote drives, and TV, radio, newspaper ads. Activities should concentrate on safety, cost benefit, and efficacy and should avoid negative campaigns. Negative campaigns don't work. Instead, they raise voter doubt. Education projects should present the facts, not argue or debate with so-called experts opposed to fluoride. It is critical to know the position of the local media prior to initiating a campaign. The local media have a powerful influence in politics and can be a best friend or a worst enemy. Using the media can backfire on a campaign if they are not in support of community water fluoridation. It is also important to know what type of media the voters use as their source for information. And knowing who votes and when is beneficial in planning a fluoride campaign, it is also important to know if your community demonstrates voter apathy, as low voter turnout is not positive for water fluoridation. Low voter turnout generally has a negative impact because of a contingent that always votes and always know regardless of the issue exists in most communities. With low turnout, this group can sway the outcome of the election. Voter turnout is higher during mayoral elections. The typical voter, according to the USA, is well educated, middle class, urban, white, female, and how owner to uh, ascertain local voter information. It may be beneficial to conduct a public opinion poll determining how many people will vote and how they will vote on the fluoride issue. Ethics of community water fluoridation. Research has provided that fluoridation is safe and effective. Yet opposition argues the ethics of adding an element to community water. Professor of philosophy John Harris successfully argues the ethics of community water fluoridation, stating, "The issue of the ethics of fluoridation seems to me to be both simple and straightforward. The issue depends on establishing that fluoridation is both harmless and beneficial. Relying on evidence from a number of sources, there is no reason to suppose that fluoridation of the public water supply to the level of 1 part per million, that is invisible and envisaged in anything but safe." Harris argues the civil rights of water fluoridation by stating, "In short, not all constraints of free choice are constraints on liberty. Citizens living in a community that adds fluoride to their water are no less free than those living in a community that does not." And global programs is a fluoride. Community water fluoridation worldwide. Water fluoridation has provided safe and effective in worldwide research conducted for more than 60 years. Currently, 39 countries worldwide provide artificially fluoridated water supplies, serving millions of people. In addition, about 40 million individuals drink naturally fluoridated water. And fluoridated bottled water. The rise in consumption of bottled water plays a role in community water fluoridation, as more people, especially children, are consuming bottled water. Community water fluoridation has less impact on the greater population. However, those who need fluoride the most, the poor, may not consume as much bottled water. Also, companies are optimizing the fluoride in their bottled water to give consumers a choice. Health conscious parents have a choice to give their children bottled water with or without fluoride levels optimized. And bottled water with fluoride added can be readily purchased at most grocery stores. School water fluoridation. Other fluoride programs have been attempted with less success than community water fluoridation. One such alternative to community water fluoridation is fluoridating a school's water supply system. This method can be used if the school has a stand-alone water system that is not connected to the community water supply. Because children are only at school part of each weekday, the recommended concentration is 4.5 times the optimal concentration for a community system. And school water fluoridation systems present several concerns. Maintaining school systems that are smaller than typical community fluoridation systems creates difficulties which can result in higher than recommended fluoride concentrations in the drinking water. Although these higher concentrations present reason for concern that they have resulted in lasting effects among children. Fluoride Wins programs. Approximately 3 million children in the United States participated in school-based fluoride mouth rinsing programs during the 1980s. A study conducted by the National Preventive Dentistry Demonstration Program reported that these fluoride mouth rinses had little effect among school children, either among first-grade students with high and low caries experience or among all second and first-grade students. Fluoride WINS programs implemented through school programs have demonstrated limited success. The school programs depend on teacher and or school nurse compliance and individual parental consent. The teacher must set aside time for students to participate in the WINS program. In addition, individual consent by parents often results in children at higher risk for caries not being included in the program. Therefore, it is difficult for a school WINS program to truly target the children who could benefit most. Fluoride varnish. Fluoride varnish programs are being implemented as community health programs to assist in reducing the incidence of dental caries. Particularly in the very young, high concentration fluoride varnish is painted directly into the teeth. The varnish is not intended to adhere permanently. Instead, it holds a high concentration of fluoride in contact with the teeth for several hours. Fluoride varnish has several advantages, including ease of application, a non-effective taste, and use of smaller amounts of fluoride than required for gel application. Fluoride varnish is considered the most effective professional fluoride treatment for primary caries. And fluoride varnish programs appear to be most effective when integrated into an existing program such as women, infants, and children, or Head Start or Well Child checkups with a trained healthcare professional. The Nevada Healthy Smile Happy Child program has developed training materials for health professionals to start a fluoride varnish program. And what about the salt fluoridation? Salt fluoridation is an alternative in areas where water fluoridation is not possible. France, Germany, Switzerland, and certain South American countries use salt fluoridation. The recommended concentration is 400 milligrams of salt. The World Health Organization has established the following criteria for salt fluoridation. Where water fluoridation is not possible, where there are low levels of fluoride, where the political will to introduce water fluoridation is absent, where there is a centralized salt production with strong technical support, and additionally appropriate labeling of the salt packages is essential. And milk fluoridation, delivered through school-based programs, has proven to effectively reduce caries in children. In spite of its efficacy, milk fluoridation is limited as an oral health promotion intervention. Milk is difficult to deliver as it must be continuously refrigerated. And fluoride tablets were originally designed to be dissolved in water and given to a child throughout the day. Eventually, the pill-oriented society evolved into giving a tablet to be chewing up and swallowed once a day. Currently, several countries have established recommended dosage schedules for fluoride tablets, and these dosage schedules differ among countries but all are based on assessing risk factors for dental caries for the individual person. And tobacco prevention is a global oral health promotion program established by the World Health Organization. Each year, the World Health Organization identifies one day as World No Tobacco Day. This effort is an attempt to encourage those who smoke to quit and those who do not to stay tobacco-free. This yearly celebration informs the public on the dangers of using tobacco, the business practices of tobacco companies, what World Health Organization is doing to fight the tobacco epidemic and what people around the world can do to claim their right to health and healthy living and to protect future generations. World Tobacco Day, established in 1987, is an example of an effective collaborative health prevention effort that focused on educating the public about diseases that using the substance can cause. And the World Health Organization has selected a topic of themes each year to combat the use of tobacco. Examples of previous themes include tobacco, deadly in any form or disguise, tobacco-free film, tobacco-free fashion, and tobacco-free sports. Campaign materials such as interactive websites, publications, videos, a site to register your local activity, and press releases for the public and professionals are produced. Xylitol is a high-carbon sugar alcohol used in many foods and snack items. It prevents mutant streptococci from metabolizing other sugars and inhibits animal demineralization. It is an important method of dental caries control in many countries, including Finland, where it is distributed with college lunches and in military survival packs. The world is changing. The world is changing more rapidly than ever before, and it is estimated that the population will be much more culturally diverse in the near future. These changes bring new challenges to those working to promote health and prevent disease. Oral health professionals must provide culturally appropriate services in a cost-effective manner, and the major challenges to the future will be to translate knowledge and experiences of disease prevention into action programs, and this will require the use of technology, development of an appropriate professional workforce, and use of any evidence-based interventions. And oral health promotion, the process of enabling people to increase control over and to improve their health, is directed at four preventable oral diseases. It's a dental caries, disease of the supporting structures, oropharyngeal cancers, and spotlight-related craniofacial injuries. Prevention or stopping disease before it occurs or in its early stages is central to health promotion. And amelioration of health inequities also is essential as the poor, minorities, and elderly share a disproportionate amount of preventable oral disease. The primary goal of oral health promotion is to reduce the prevalence of oral disease through education and other interventions. And professionals abide by a rule or code of ethics that promotes health for the public. Current statistics clearly reveal that oral disease is one of the most prevalent health problems in society. As community members and as healthcare providers, we have a responsibility to be involved in health promotion to address this issue. The oral health professional can be involved in oral health promotion and help meet the objectives on healthy people by resolving the influence social change, implement community programs, and work with existing effective programs.